In this video, we're going to highlight key signs that indicate heart problems before they become serious. Stick around to the end because what you learn here will make all the difference in catching these issues early. If you find this helpful, please like the video and subscribe for more health insights. Chest discomfort or pain is one of the most significant early signs of heart problems. This symptom is frequently associated with heart conditions, and it should not be ignored. When the heart muscle isn't receiving sufficient blood flow, a person will experience this discomfort. The sensation often manifests as a feeling of pressure, tightness, or squeezing in the chest. It is a sign that the heart is under strain and struggling to pump blood effectively. The pain will often radiate to other areas such as the shoulders, neck, jaw, or arms, making it difficult to pinpoint the exact source. This type of discomfort is commonly linked to angina, a condition caused by reduced blood flow to the heart muscle due to narrowed coronary arteries. Unlike general muscle pain or indigestion, this type of chest pain will persist and is not easily relieved by rest or antacids. It is crucial to recognize the difference between chest pain that is related to heart issues and other types of pain. Heart-related chest pain often occurs during physical exertion, emotional stress, or even while at rest. It will typically last for a few minutes, but it may also subside and return. The intensity and nature of the pain vary. It might feel like a heavy weight is sitting on your chest, or as though something is squeezing the life out of you. Ignoring or dismissing chest discomfort as something minor is a mistake. Such pain will be an early indicator of more serious underlying heart conditions, such as coronary artery disease or even a heart attack. Prompt medical attention is necessary if you experience any form of chest pain, especially if it is accompanied by other symptoms such as shortness of breath, sweating, or nausea. In some cases, chest pain might not present itself in the traditional way, particularly in women. They may experience a sharp, burning pain instead of the more typical heavy pressure. Regardless of the nature of the pain, it is essential to seek medical advice immediately. Early detection and intervention will make a significant difference in managing heart health and preventing life-threatening conditions. Shortness of breath is another critical early sign of heart problems that warrants close attention. This symptom arises when the heart is unable to pump blood effectively, leading to a reduced supply of oxygen to the body. As the heart struggles, the lungs will not receive enough oxygen-rich blood, causing difficulty in breathing. This can occur during physical activities, daily tasks, or even while lying down. Unlike the breathlessness experienced after intense physical exertion, this form of shortness of breath persists and is disproportionate to the activity level. It may come on suddenly or develop gradually over time. When the heart is not functioning optimally, fluid will accumulate in the lungs, making breathing labored and shallow. This condition, known as congestive heart failure, places a significant strain on the body and needs immediate medical attention. Shortness of breath will also be accompanied by other symptoms such as chest discomfort, fatigue, or swelling in the legs and ankles. These signs together indicate that the heart is not supplying the body with the blood and oxygen it requires. The symptom might be more pronounced when lying down, as gravity allows fluid to shift into the lungs more easily, worsening the difficulty in breathing. This is known as orthopnea, and it is a specific indication of heart failure. Experiencing shortness of breath during sleep, often causing a person to wake up gasping for air, is another concerning sign. This condition is referred to as paroxysmal nocturnal dyspnea. It results from fluid accumulation in the lungs that occurs when lying flat, leading to sudden and severe breathlessness that disrupts sleep. People with this condition will often feel the need to prop themselves up with pillows to breathe more comfortably. Recognizing shortness of breath as an early indicator of heart problems is essential for timely intervention. Ignoring or dismissing this symptom could lead to more severe complications, such as a heart attack or worsening heart failure. It is crucial to seek medical advice promptly if you experience unexplained shortness of breath, particularly if it is accompanied by other signs like chest pain, fatigue, or swelling. Fatigue and weakness are often overlooked as early signs of heart problems, yet they are significant indicators of underlying cardiovascular issues. Unlike normal tiredness that results from a lack of sleep or physical exertion, fatigue related to heart problems is persistent, overwhelming, and does not improve with rest. This type of fatigue occurs because the heart is struggling to pump sufficient blood to meet the body's needs, leading to a decrease in oxygen and nutrient delivery to the muscles and organs. When the heart is unable to function effectively, the body prioritizes blood flow to vital organs, such as the brain and lungs, often at the expense of the muscles and peripheral tissues. This redistribution of blood can result in a constant feeling of exhaustion, even after minimal physical activity. Tasks that were once easy, such as climbing stairs or carrying groceries, may become challenging and leave you feeling unusually drained. In addition to physical fatigue, there is often a sense of mental or cognitive fatigue. This may manifest as difficulty concentrating, memory lapses, or a general sense of being mentally foggy. The brain requires a steady supply of oxygen-rich blood to function properly, and when the heart is not pumping efficiently, cognitive functions will be affected. Weakness is another key sign that accompanies fatigue in the context of heart problems. It is characterized by a general lack of strength and stamina, often making simple tasks feel overwhelming. The muscles may feel heavy or sore, and you might experience difficulty standing, walking, or performing routine activities. This weakness will be more noticeable in the arms and legs, as these areas are more prone to the effects of reduced blood flow. An irregular heartbeat, also known as palpitations, is another early warning sign of heart problems. Palpitations occur when the heart beats too quickly, too slowly, or with an irregular rhythm. These abnormal heart rhythms, known as arrhythmias, indicate that the heart's electrical system is not functioning properly. When the heart's rhythm is disrupted, it will lead to feelings of fluttering, pounding, or even a racing heartbeat. Palpitations are often described as the sensation of the heart skipping a beat or adding an extra one. This feeling can be alarming, especially when it occurs unexpectedly or during periods of rest. While palpitations can be caused by stress, anxiety, or caffeine, they are also linked to more serious heart conditions such as atrial fibrillation, ventricular tachycardia, or premature ventricular contractions. In these cases, the heart's ability to pump blood effectively is compromised, which can lead to insufficient blood flow to the body and brain. One of the key concerns with an irregular heartbeat is its potential to lead to more severe complications. For instance, atrial fibrillation, a common type of arrhythmia, will increase the risk of stroke and heart failure if left untreated. This condition is characterized by rapid and irregular beating of the upper chambers of the heart, which can result in blood pooling and clot formation. If a clot travels to the brain, it will cause a stroke, making early detection and management of palpitations critical. In addition to the physical sensation of an irregular heartbeat, you may also experience accompanying symptoms such as dizziness, shortness of breath, chest pain, or fatigue. These signs suggest that the heart is struggling to maintain a regular rhythm, and the body's organs are not receiving adequate oxygenated blood. Palpitations that are persistent, last longer than a few seconds, or are accompanied by these other symptoms require immediate medical attention. Swelling in the legs, ankles, or feet, medically referred to as edema, is an important early sign of heart problems. This condition occurs when the heart is unable to pump blood efficiently, leading to a buildup of fluid in the body's tissues, particularly in the lower extremities. The heart's compromised ability to circulate blood effectively causes fluid to leak from blood vessels into surrounding tissues, resulting in noticeable swelling. Edema in the legs, ankles, or feet often appears gradually and may be more pronounced after periods of prolonged standing or sitting. The swelling will cause discomfort, heaviness, or a feeling of tightness in the affected areas. Shoes or socks may leave deep indentations on the skin, and the skin may appear stretched or shiny. Pressing on the swollen area will often leave a temporary indentation known as pitting. This type of swelling is particularly concerning because it indicates that the heart is struggling to maintain proper circulation. When the heart's pumping efficiency is reduced, blood returning to the heart from the lower body can pool in the veins, leading to increased pressure in the blood vessels and subsequent fluid leakage into the surrounding tissues. This condition is commonly associated with heart failure, where the heart's ability to pump blood is significantly impaired. In addition to swelling, edema will be accompanied by other symptoms such as shortness of breath, fatigue, or rapid weight gain due to fluid retention. These signs collectively point to a worsening of heart function and require immediate medical attention. Ignoring or dismissing swelling in the legs, ankles, or feet as a minor inconvenience can lead to a progression of the underlying heart condition, resulting in more severe complications. Edema related to heart problems is often more pronounced at the end of the day or after physical activity. The swelling may also worsen over time if the underlying heart condition is not addressed. It is crucial to recognize this symptom as an early indicator of heart issues and seek medical evaluation to determine the cause and appropriate treatment. Dizziness or lightheadedness is another early sign of heart problems that should not be taken lightly. This sensation occurs when the heart is not pumping blood effectively enough to supply the brain with the oxygen and nutrients it needs. As a result, you may feel faint, unsteady, or as if you are about to lose consciousness. This can be an alarming experience, especially if it happens frequently or suddenly, and it is often a precursor to more serious cardiovascular issues. The heart's primary role is to pump blood throughout the body, ensuring that all organs, including the brain, receive an adequate supply of oxygen-rich blood. When the heart's function is compromised, as in cases of heart failure, arrhythmias, or coronary artery disease, the brain will not receive sufficient blood flow. This lack of blood flow can lead to dizziness or lightheadedness, particularly during physical exertion, when standing up quickly, or after a period of prolonged rest. This symptom is particularly concerning when it occurs in conjunction with other signs of heart problems, such as chest pain, shortness of breath, or an irregular heartbeat. Dizziness in this context could indicate an arrhythmia, where the heart's rhythm is disrupted, causing periods of decreased blood flow to the brain. It could also be a sign of low blood pressure, hypotension, due to heart failure, where the heart is unable to maintain adequate pressure to keep blood circulating properly. In some cases, dizziness or lightheadedness will precede a more serious event, such as a heart attack or stroke. For instance, a person may feel suddenly dizzy as a result of a heart attack, where the heart muscle is damaged and unable to pump blood effectively. Similarly, a transient ischemic attack, TIA, often called a mini-stroke, can cause temporary dizziness as blood flow to the brain is briefly interrupted. Nausea and vomiting are often overlooked as early signs of heart problems, but they are significant indicators, particularly in the context of a heart attack. While these symptoms are more commonly associated with gastrointestinal issues, they will also manifest when the heart is under severe stress. Recognizing nausea and vomiting as potential heart-related symptoms is crucial for early detection and prompt treatment. When the heart is struggling, especially during a heart attack, the body's response will trigger nausea and vomiting. This occurs because the heart's inability to pump blood effectively reduces oxygen supply to vital organs, including the digestive system. The reduced oxygen levels and increased stress on the body lead to discomfort, including nausea. Vomiting will follow as the body reacts to the distress signals from the heart. Nausea and vomiting as early signs of heart problems are more commonly reported in women than men, making them essential symptoms to watch for in cases of suspected heart issues. In many cases, women experiencing a heart attack will report these symptoms along with other atypical signs like fatigue, shortness of breath, and back or jaw pain. This variation in symptoms compared to the classic presentation of a heart attack in men often leads to misdiagnosis or delayed treatment, underscoring the importance of awareness. It is also important to note that nausea and vomiting related to heart problems will occur alongside other symptoms, such as chest discomfort, sweating, or lightheadedness. These accompanying signs provide a clearer indication that the nausea is not merely a digestive issue but a potential cardiac event. The sudden onset of nausea and vomiting, especially in individuals with risk factors for heart disease, should prompt immediate medical evaluation. In some cases, nausea and vomiting will also be linked to conditions like heart failure, where fluid buildup and poor circulation lead to digestive disturbances. The body's struggle to maintain adequate blood flow can cause congestion in the liver and digestive tract, resulting in these symptoms. Unlike temporary nausea from other causes, heart-related nausea is persistent and does not improve with typical remedies. A persistent cough, particularly one that produces white or pink frothy mucus, is an important early sign of heart problems. This symptom often indicates that the heart is not functioning efficiently, leading to fluid buildup in the lungs. The underlying cause of this condition is typically heart failure, where the heart is unable to pump blood effectively, resulting in congestion in the lungs. When the heart's pumping ability is compromised, blood returning from the lungs to the heart can back up, causing fluid to leak into the lungs. This condition, known as pulmonary edema, will trigger a persistent cough. The cough may start as a dry, hacking cough, but will progress to produce a frothy sputum as fluid accumulates in the lungs. This type of cough is particularly concerning because it reflects a significant level of heart dysfunction. The presence of pink or blood-tinged mucus is a more severe sign that requires immediate medical attention. This occurs when the pressure in the blood vessels of the lungs is so high that it causes small blood vessels to rupture, leading to blood mixing with the fluid in the lungs. This type of cough is a clear indication that the heart failure is advanced and that the body is struggling to maintain normal lung function. Persistent coughs associated with heart problems are often worse when lying down. This is because lying flat increases the pressure on the lungs, making it more difficult for fluid to drain away, leading to more coughing. Many people with this condition find that they need to prop themselves up with pillows at night to alleviate the coughing and breathe more easily. In addition to the cough, individuals will also experience other symptoms of heart failure, such as shortness of breath, fatigue, or swelling in the legs and ankles. The combination of these symptoms points to the heart's inability to maintain adequate circulation, which results in fluid buildup in various parts of the body, including the lungs. Recognizing a persistent cough as a potential sign of heart problems is crucial for early intervention. Ignoring this symptom could lead to a worsening of the underlying heart condition, resulting in more severe complications like acute pulmonary edema or respiratory failure. If you or someone you know is experiencing a persistent cough, especially with frothy or pink mucus, it is essential to seek medical evaluation to determine the cause and initiate appropriate treatment. Cold sweats are a significant early sign of heart problems, often indicating that the body is under severe stress, particularly in the context of a heart attack. Unlike regular sweating that occurs from heat or physical exertion, cold sweats happen suddenly and without an apparent cause. They are the body's reaction to intense stress, pain, or an inadequate supply of oxygen, all of which are common during cardiac events. When the heart is not pumping blood effectively, the body will enter a state of shock. The nervous system, sensing that something is wrong, triggers a fight-or-flight response. This response releases adrenaline, which causes the blood vessels to constrict and redirects blood flow to vital organs. As a result, the skin will become cool and clammy, leading to cold sweats. This symptom is often accompanied by a feeling of impending doom or severe anxiety, which further intensifies the body's stress response. Cold sweats are particularly concerning when they occur alongside other symptoms of a heart attack, such as chest pain, shortness of breath, or dizziness. In these cases, the body is signaling that it is struggling to maintain adequate circulation and oxygen supply. The onset of cold sweats, especially if they are unexplained and occur during rest, should be taken seriously as a potential warning sign of an impending heart attack. It is important to distinguish cold sweats from other types of sweating that may result from environmental factors, fever, or illness. Cold sweats typically involve a sudden and intense onset, with the skin feeling cold and clammy to the touch. They may be localized to certain areas, such as the face, neck, or chest, and are often associated with feelings of weakness or lightheadedness. Ignoring cold sweats as a mere inconvenience can have serious consequences, especially if they are a symptom of a heart attack. Prompt recognition and action are crucial. If you or someone else experiences cold sweats along with other heart-related symptoms, it is essential to seek emergency medical attention immediately. Early intervention during a heart attack will dramatically improve the chances of survival and reduce the risk of long-term damage to the heart. Pain in the arm, neck, jaw, or back is a commonly overlooked early sign of heart problems, yet it is a critical indicator of an impending heart attack. Unlike the classic symptom of chest pain, which is often associated directly with the heart, pain radiating to these areas is less obvious but equally significant. This type of pain occurs because the nerves that supply the heart also supply these regions of the body, causing what is known as referred pain. Referred pain is the result of the heart's inability to function properly, typically due to a blockage in the coronary arteries. When the heart muscle is deprived of oxygen, it sends distress signals through the nervous system. These signals can manifest as pain in areas not directly connected to the heart, such as the left arm, shoulders, neck, jaw, or even the back. This pain will be sudden or gradual, and it can vary in intensity, from a dull ache to sharp, stabbing discomfort. The most common form of referred pain associated with heart problems is pain radiating down the left arm. This pain often starts in the chest and spreads outward, though in some cases it might occur without any chest discomfort at all. Women, in particular, are more likely to experience heart-related pain in the neck, jaw, or back, making it crucial to recognize these symptoms as potential signs of a heart attack rather than dismissing them as unrelated issues. Pain in these areas is often mistaken for musculoskeletal problems or other less serious conditions. For example, pain in the jaw or neck might be attributed to dental issues or muscle strain, while back pain could be mistaken for a pulled muscle or spinal problem. However, the key difference is that heart-related pain will often be accompanied by other symptoms such as shortness of breath, nausea, or cold sweats. These additional symptoms provide a clearer picture that the pain is linked to heart distress. We appreciate you watching. Remember to like and subscribe if you found this helpful. For more content, just click the video on the screen and keep watching.